Leeds Teaching Hospitals NHS Trust has made some really significant changes during recent years, resulting in huge improvements for staff and patients. Our first step was a conversation with our staff to define our shared vision and values, and together we created a way of working that we called the Leeds Way. Holding the vision and values at the centre of everything we do has enabled us to drive improvements, helping us transform the care we provide. We've gained national recognition for our achievements, including being rated as good by the national inspection body, the Care Quality Commission. Our mantra is continuous improvement, and we are always looking to improve patient experience, patient safety, efficiency and sustainability. We have worked really hard to ensure our staff have the skills to improve systems and processes. This has really engaged our teams, who know how important it is to understand value and waste from a patient perspective. As a result, the Leeds Improvement Method is going from strength to strength across the organisation. Now we are ready to build on these foundations, ready to make the move from good to outstanding. Let's look at just a few ways in which our clinical teams are aiming to do this.
Here in Leeds, our Teledermatology service has transformed the way we are diagnosing and treating skin cancer. From the comfort of a GP surgery, images are sent to be triaged by a consultant dermatologist, saving the patient a potential unnecessary hospital visit. To date, we've been able to save over 2,500 outpatient appointments. So what does the future hold? We hope in the near future to be able to diagnose all skin cancers when patients are still based in their GP surgery and triage them directly for a surgical procedure, making sure they see the right person first time, every time.
I think LTHT is going to be a pioneer in embedding artificial intelligence within breast imaging. We are working with UK-based companies that have developed algorithms that can help in the diagnostic pathway, where they can help us interpret mammograms. And this will have a huge impact, not only within the quality of the service we provide. It's important that we create efficiency within the workforce, but at the same time drive standards and quality. And I think LTHT will be leading the way with regards to that.
In the last few years, we've now moved to using digital pathology in clinical practice. It's a technology that allows us to look at cancer and diagnose cancer using a digital screen instead of a microscope. And to date, Leeds is one of the biggest hospitals in the world that uses this technology in their laboratory. So this is going to be very exciting 5 to 10 years. This is a new technology that's going to revolutionise how we do cancer, and Leeds is at the centre of that revolution. We've obtained funding to expand our project across all of the hospitals in West Yorkshire, and we'll be introducing the use of artificial intelligence to help us diagnose cancer. So there's a lot of work to do and a lot of things that we can achieve.
Our research here at LTHT and the University of Leeds is looking at ways of stimulating the immune system to improve the response to these immunotherapies. One way that we're doing that is by using live viruses.
So we're really excited to be able to report that we've now completed 2 unique clinical studies using this approach in our brain tumour patients here in Leeds. Based on those results, we've recently completed a second study where we've added the virus treatment to our standard treatment for these patients with poor prognosis brain tumours. So they have radiotherapy and chemotherapy and virus treatment. We're very optimistic that those results will show that this is a safe treatment, and we'll then be able to go forward to see how we should best use this combination to really see if we can improve the outlook for this terribly poor prognosis disease.
Developments in genetics over the past decade have meant that it's now possible to read off an individual's whole genome in an NHS laboratory, and whole genome sequencing is now something that we can perform. And the central sequencing laboratory for this region, for this genomic laboratory hub, was awarded to LTHT, and this means that we can now transfer data digitally and transfer samples between the laboratories across the entire patch, from as far away as Whitehaven over on the Irish Sea coast down as far as Chesterfield. Those samples and data can be transferred here to Leeds. What this means is that we now have a fantastic partnership which should be able to leverage the data on all these 10.5 million people across this region, and it's a fantastic example of collaborative working between NHS facilities in this area.
The people whose amazing work informs these case studies exemplify everything that is happening across our hospitals now. This is a really exciting time for us all as we seek to maximise the potential we have to realise our vision to be the best for integrated and specialist care and to become one of the absolutely top performing hospitals in the country. The changes we want to see during the next 5 years will not be simply more of the same. We believe they will take us to another level based on our academic and clinical partnership with the University of Leeds. We're already one of the UK's top hospitals for research and innovation. Our financial sustainability gives us confidence that our ambitious bid to redevelop our city centre site, building 2 new hospitals, including a dedicated children's hospital, will ultimately bring incredible new clinical facilities that will transform the care that we can provide for patients. We are an excellent employer and a key partner in the local economy, providing apprenticeships, training and education through our Health and Care Academy, aiming to help create a uniquely qualified and multi-skilled single workforce that can meet the needs of the city's future health and care sector. Our patients are at the heart of everything we do, and in addition to providing outstanding treatment, our strategy is to work towards improving population health by prevention and early diagnosis. We intend that the people of Leeds and the wider region will be proud to be served by our great hospitals and that our staff will be proud of the care they provide for you.